16% of the population will be vaccinated in phase 1 of a 4-phase distribution strategy under the National COVID-19 Vaccine Deployment and Vaccination Interim Plan. Minister of Health and Wellness, Dr. Christopher Tufton, says phase 1 will cost about $3 billion. The second phase will see an additional 16% of the population being vaccinated. He shared the details of the plan in Parliament on Tuesday.
The Health and Wellness Minister, Dr. Christopher Tufton, says the National COVID-19 Vaccine Deployment Plan is aligned with the National COVID-19 Response and Recovery Program. It includes planning and coordinating vaccine introduction, legal and regulatory framework.
Phased approach of COVID-19 vaccination introduction in Jamaica, targeted populations and vaccination delivery strategies, human resource management and training, supply chain management, risk assessment and mitigation strategies, vaccine program communication, and vaccine safety monitoring, and COVID-19 vaccine program monitoring and evaluation. So a number of elements of the strategy.
He says a multi-sectoral approach for implementation of the 4-phased plan has been established.
Phase 1, vulnerable and priority groups. Phase 2, other priority groups and the introduction of vaccine to the general public. And phase 3 and 4, more of the general population will have access to the vaccine.
In phase 1, only 16% of the population is targeted, with the supply coming from the World Health Organization's COVAX facility.
It is also our intention to continuously seek out supplies of vaccines to ensure as many Jamaicans as possible at any given time can be protected. We will seek additional doses of the vaccine based on locally relevant risk factors, vulnerabilities, and the COVID-19 threat. The initial projection for the second phase is a further 16% of the population.
He also spoke of plans for efficient distribution to targeted population.
Once in Jamaica, vaccines due to their fragility or temperature sensitivity are given special status by both the Ministry of Health and Wellness personnel and the customs officers at the airport. This allows for timely clearance, transport to central stores where they are checked by the program officer and National Health Fund warehouse staff to ascertain their condition. Madam Speaker, current cold storage capacity at the central and peripheral or parish levels is limited. Given the anticipated overall increase in the number of vaccines, approximately 1 million dosage, additional storage capacity will be required. Each parish will need at least one additional vaccine refrigeration facility to accommodate the COVID-19 vaccine. At the central stores, an additional 10 to 20 freezers.
Dr. Tufton says phase 1 will cost $3 billion Jamaican dollars.
This covers, among other things, the purchase of the vaccines, supply chain and cold storage items, PPEs, transportation, staff training, staff costs, public education, and sensitization cost.
The Health Ministry says the second phase will be continuous based on the need for re-vaccination and the level of immunity achieved by the population.
This phase may see the vaccine becoming a part of routine immunization schedules, and procurements will be absorbed into the regular budget for immunization. This will have to be expanded based on demand and availability of funds. So there is still some amount of flexibility which has to be exercised based on what we learn as we go along.
He says preparation has already begun for the introduction of the COVID-19 vaccines for timely and smooth implementation once they become available. For the news on PBCJ, I'm Simone Absalom Gale.